And good morning, everyone. TJ Alds, I-45 now, and Galveston now, along with Dr. Philip Keiser, the local health authority for Galveston County, as well as the interim CEO and director of the Galveston County Health District and Coastal Health and Wellness. Your title keeps getting longer every single time I talk to you here, Dr. Keiser. And our apologies to those who couldn't get with us yesterday. Both of us had scheduling conflicts that kept moving our schedule on Wednesday. But we wanted to make sure we had the show this week because of a lot of important stuff coming up. One of those is news, Dr. Keiser, is we talk about that was released by the health district as of the 19th of how many folks from the Clear Creek Community Church. And we want to clarify something here. The camp that the members of this church went to was in Central Texas. It was not here locally. So that's important to note. Location does matter in many cases here. And it's both Galveston County and Harris County, but your office as well as the office of Harris County have been working together. A number of infections. What are we at on that right now? And I want to talk, and we'll go into the breakthroughs, but right now, where are we at as far as statistically as regards to that church camp incident?
Yeah, so we have 157 cases. That's been stable for about the past week or so. I mean, we may have picked up one or two extra, and I think this outbreak has pretty much run its course from that point of view. And so typically when you have outbreaks, they go way up and then they kind of plateau and then go down. So we haven't had any new cases. We're past the point where we expect anybody to get sick at this point. If somebody gets sick, it would be surprising to me. So all in all, I think this has played itself out for the most part. I think you're right that it's important for people to know that this camp was not actually in Galveston County. The church sent its kids to a camp, but unfortunately, the church has been bearing the brunt of this and has been accused of all sorts of things when quite frankly, we found the pastor and the leadership of the church to be very concerned and very cooperative and really trying to help us work through all the issues and making sure that everybody in their church is safe.
Yeah, we should point out, in all fairness, Clear Creek Community Church, they have been one of the, within the faith community particularly, one of those that's been very aggressive about putting in safety protocols, not only the church, but everything else. And in this case, they thought they had gone through all the protocols. You have said this often, that it's something like this was going to happen at some point, even after the vaccinations came out. And you had said early on, it was going to be interesting to find out what happened here to be able to kind of better respond afterwards, and to be fair to the church too, and knowing how much they do in the community and in our faith community as well. But you just said it. I just wanted to get a chance to reiterate how much they have been cooperating with information sharing and getting the word out to their membership.
Yeah, no, they've really done that, and they've done it in a way that I think has protected people's privacy as well as getting us the information that we need. And that's, of course, is very, very difficult. And in this current environment, a lot of people are just very concerned, when the government shows up and says, hey, we want all this information on people. And so, but we've been able to get the information we need. We're actually, one of the lessons that's come from this is that the Delta variant is extremely infectious. And we're going to continue to do some more work on this to try and better understand how the Delta variant is transmitted. And we're actually working with CDC and with the church and with the state of Texas. And so we're trying to get some more information and do all the calculations that need to get done to understand that better, so we can prepare better for as we see Delta spread through the community.
I will talk more about Delta variant in a little bit. In this particular case, it's about a third of the 450 people who were at the camp, mostly teenagers. They were there. Of the 450, roughly or so, there, how many were vaccinated?
Well, we don't know that yet, and we're working on getting all that information. We've talked about this before. We know about the positives, right? So if you're positive, then that kind of puts you in the public health realm, and it's a reportable disease. And we say to people, okay, we're trying to figure this out. And people have been very cooperative about that and been very helpful. If you're negative and we don't know about you, and we actually have no right to go up and start knocking on people's doors and saying, are you vaccinated or not? So that's where the issue of communication and persuasion and building trust comes in.
But there were 20 breakthroughs.
That's
Is
right.
that the latest number
Yeah.
there? And on that, it gets into with those breakthroughs. We're seeing more and more reports about breakthroughs. First, let's go ahead and give a definition. In short, it is you were vaccinated, but then you were fully vaccinated, but then came down with an infection. Now, one of the things that, again, we have said this, I don't know how many times on the show, vaccination doesn't mean absolute 100%. You're never going to get something. That doesn't happen with any vaccine that's out there. But in this case, was it surprising to have a higher number of breakthroughs? Or do you think it's a lot because of the Delta variant, or is it a combination of both?
Well, I know we were surprised at the number of breakthroughs we saw. Just to put it in perspective, as of Tuesday, I think we had like 107 breakthroughs in the county total, 20 of which came from this particular outbreak. Now, what does that mean? I think the reason why this is so interesting to everybody is because you have a group of people who are not infected. They all go to one place. They don't go anywhere else. And then a week later, you get at least a third of the people there infected, including a bunch of breakthroughs. So it takes out a lot of variables about how and where and when people got infected. And so we know that most of the people got infected either at camp or from people who went to camp directly. And we would not have expected 20 breakthroughs in a group that size, even if all of them were vaccinated. And we know not all of them were vaccinated. So just guesstimating, anywhere from a third to half based on the age group were vaccinated. That 20 out of that is really high. And 20 out of 107 that we know total, that seems to be really high. So what that says is that there's something about this Delta variant that's different. And we need to understand this because this has implications on booster shots and revaccinations and even whether people should be wearing masks in schools and mass gatherings again, even if you're vaccinated. I think understanding what happened there is going to give us very, very important information and understanding those answers to those questions.
And we're going to talk a lot about a lot of those items here coming up as we continue here with What You Need to Know with Dr. Philip Keiser. We'll be back after this word from the Galveston County Health District and Coastal Health and Wellness.
Hi, I'm Christina Garcia. I'm the Patient Services Manager at Coastal Health and Wellness. I want all Galveston County residents to know that the open enrollment for the healthcare insurance marketplace is now. At Coastal Health and Wellness, we understand the importance of having access to high quality health care. And we understand that the application process can sometimes be stressful, trying to figure out which plan is best for you and your family. So we have certified application counselors that are waiting to walk you through the process. There are 4 categories of plans to choose from, and our counselors will help you through the process. All the plans will cover essential health benefits, pre-existing conditions, as well as preventive care. So what do you need to know, Galveston County residents? The time to act is now. If you need assistance or if you have questions, call us. At Coastal Health and Wellness, we're here to help you.
And back here now with Dr. Philip Keiser on our usual routine get together of what you need to know, and a lot of COVID-19 conversations of going on. And you mentioned here about booster shots. I've asked you this, I don't know how many times. I myself have been looking at it is someone who had Pfizer just as a precautionary, not as only because I'm out a lot and the like. But I've gotten that question from a lot of folks.
Yeah.
What is the recommendation now? I know research is being done, but where do we stand on understanding of if and when maybe booster shots may be needed? Pfizer itself is making an argument before the health administrators to say, no, we think after a certain time we see some waning and we'd like to provide a booster shot. But the CDC is saying, whoa, we don't need that right now. But they're presenting that this week. In fact, can you talk about where we are and what's your thought on that whole process?
Yeah, I honestly don't know. That's a really good question. So let's lay out what the issues are. So the first thing is that the vaccines give you antibodies, right? But our immune system is not just antibodies. It comprises things that we call T cells, which help the body remember and respond to either new infections or old infections. And so what's been seen is that over time, antibodies tend to start waning. They start to go down in levels, and they reach levels that some people are concerned that it's not enough to protect against infection. However, there's been a study that was just published this week that showed that it's not just the antibodies that respond when people get re-exposed after having an infection, after being vaccinated. They also have those T cells respond in a very, very robust way. Now, there's a difference in how people interpret this. People that study viruses, the virus itself, they look at how rapidly things are mutating, and they say, this isn't going to last. And whereas those who study the immune system look at it from a point of view saying, well, the T cells are pretty good. It may be okay. We don't have a good consensus. We do have a study that was done in Israel where after a period of time, the vaccine only protected people 66% of the time, or 66% of the people that had it. But none of those people got hospitalized, even though they were able to get reinfected. And then, of course, as we're seeing with Delta variant and all these breakthroughs, is there something about the Delta variant that makes it different from the other viruses that we've been looking at that we all need to get vaccinated? So that's the question. And I honestly don't know. I wouldn't be surprised if we end up getting booster shots. I think that companies like Pfizer and Moderna would not be doing their job if they weren't preparing for it. The real question is do we need it, and if so, when? And that's what this meeting that the CDC is going to be having this week is about, to try and answer that question.
And, UTMB Health was a clinical trial site for not only Pfizer's COVID-19 shot, but also Moderna's.
Right.
Are both companies right now looking at this booster option and improving upon? We know they were already looking at improving upon the vaccines to begin with, but are those clinical trials, like on boosters and the like, are those continuing right now within UTMB Health?
There is at least one booster study that I'm aware of. There's also booster studies that are being done up in Houston. And the one up in Houston is very interesting. It's basically, it doesn't matter what you got as your first shot, though they're going to give you a shot of Pfizer. Now, the other thing that's being done and being looked at is what about tweaking the vaccine and then including that in the booster? And there's some preliminary studies being done with that as well.
And along those lines, talk about tweaking. Let's talk about the Delta variant. We also have Lambda variant. It's not emerged obviously as big as Delta variant, but there's been a concern about Lambda variant. We've had our first kind of area case reported here on that. We also have a question about the Delta variant coming up here. But first, let me just ask you. I actually begin this. What makes the Delta variant more transmissible or more contagious? Is the term I think some people use on that.
Yeah, so this is all about what's called the spike protein, and the spike protein is exactly what the name implies. It's a spike that sticks up on the virus, and it's basically a hook. And that hook then gets up into your nose, and let me get my finger right, and kind of hooks in there. And the Delta variant, that hook is much more effective in getting in and hooking onto there. So that's the what we know about the genetics of it. But the result of that seems to be that people who have that Delta variant, they have much more virus in their nose, probably tenfold more than what was with the original coronavirus, which means that not only is it more efficient in hooking and getting in, it's also more efficient in spreading the virus to other people because there's a lot more virus in your nose, which you can then, goes in the air and other people run into, and it hooks into them.
And then another thing that's come up here this last week, and we should point out that the report that came out on this was not a peer-reviewed report. Johnson & Johnson is challenging it, but the report on Johnson & Johnson's vaccine, the one-shot vaccine, is less effective versus the Delta variant. Johnson & Johnson counters that, says that's not accurate for all the studies that we have had done, and that this report actually was a limited number, 10 people. That show is less effective on, but it is a concern for folks. And there's a two-part question of this, but it is a concern for folks when we see her as we are down the line. I mean, the first vaccines were done in December, and now most of them coming February, March. General population March, April, around that time. But is, as we get into this, people are obviously concerned and they just want to get back to their lives on a regular routine. And we're feeling that, it's kind of like the cat's out of the bag now. It's like everyone could take their mask off. Everyone could go on cruise ships again. Everyone could go to group outings again. And folks really don't want to go back to what it was before. So where does it stand on effectiveness of these vaccines against the Delta variant, and what can be tweaked to make them more effective? On this case, I guess something that would unbend the hook is the best I could describe it in an analog sense.
Well, so what can be tweaked in terms of the vaccine is really the vaccine itself. And so remember that the mRNA vaccines are basically, it's the code. It's the code for the virus and a code for the spike. So now that we know what's wrong with the Delta variant, let's say, you simply just change the code, and then the body makes antibodies to that particular thing. And so that's what Pfizer is actually suggesting. And that can be done very, very quickly. And as you can see, we started seeing Delta, well, it's July now. When did we start hearing about Delta? In probably the end of April, right? And they've already got something. And that just shows you how rapidly things can be changed with the mRNA vaccines. Now, the J&J is not an mRNA vaccine. It's what's called an adenovirus vector. And so it basically uses a different virus which carries pieces of it. And that's harder to engineer and takes more time to change. So we'll have to see how the adeno vaccines can catch up. But I expect that both Moderna and Pfizer will have something that we could use against this particular variant if needed in a reasonable length of time.
And that seemed to be the argument that Pfizer was making that it's going to make before the CDC this week, is that their improved vaccine, they've been looking at the Delta variant and how they can adjust the coding, as you said, to deal with that and to go along the way. This is a question you and I talked about yesterday briefly before we had to move the show till today, was how many, with the cases involved on the church camp, do we know which vaccines 20 of those breakthrough cases received? You told me 3 of them were Johnson & Johnson and the rest were roughly the mRNA vaccines. Right.
So 3 were Johnson & Johnson, 3 were Moderna, and the rest were Pfizer. And but none of those people have gotten sick enough to get to the hospital.
And on that does bring up a good question. How sick of people are, because it goes into that if you've gotten this, we should point out you've tested positive, but there are asymptomatic as well as symptomatic positives within this group. How many would you say are symptomatic versus asymptomatic cases within this group?
I don't have the numbers on that. I would have to check with our EPIs on that, because they do ask them, questions about how they're feeling. So we can get that for you.
And it should be one of those things that we, as you noted, you just said it, but I want to stress, because we talked about this just the other day, is that there has not been a hospitalization or a serious enough to go to the hospital and infection with any of these, which would normally indicate, mild, maybe severe enough to stay home, but not severe enough to seek really extensive care for that in there. Again, if you have a question, go ahead and put it in the comment section and bring it up. It does bring into a question of back to school coming around the corner, and we already have some questions on that. Right now, there is a debate. CDC is saying we don't need to have masks to go back, but it's revisiting that. And that comes right after National Pediatrics Association releasing, we think that should be considered for back to school. Right now, you're talking to the school districts every day, and obviously there's a state mandate that says no masks unless the parents want an option to do so. What would your recommendation be today, July 22nd, knowing that based on new information, July 23rd or even later today, that recommendation could change just based on the data that you have?
Well, right now, I would actually suggest people wear masks, and I would have parents have their kids wear masks. And the reason being is that we are seeing the numbers go up extremely fast. And what we've learned, I hate to keep referring back to the camp, but what we learned is that this variant moves fast. It moves really fast. And so because of that, I don't think we can necessarily assume that what we learned from last year is going to carry over to this year. And so, what's the harm in wearing a mask? There's basically no harm in wearing a mask. People don't like to do it. People have tried to say, oh, you breathe in too much CO2. Oh, that's not true. And I think that's been pretty well proven. That people say that they breathe in all their toxins. That's not true. It's uncomfortable. Nobody likes it. I don't like it. But it probably is the best thing to do for the time being.
And one of our regular viewers, Doreen, asking again, do we have a timeline on availability of vaccines for younger children? Obviously, that'd be under 12 years old, because right now it is 12 and up. But we don't have. I know the trials are pretty much, as I thought, wrapped up by now, but they may be still going on. Where's the status of that for vaccines for the youngsters, those younger than 12?
Well, Pfizer has been promising us a vaccine for kids to school-age kids starting September. Unfortunately, in Texas, that doesn't help us because we go back to school in August. And then the Moderna is actually going in kids as young as infants, and probably sometime later in the fall for that.
So around the corner would be about the best we could do.
Yeah.
And this gets another question. Donna Giusti had the question: if you got your second shot in February, do we know how long we're going to be protected? And that's the thing right now. It is, because essentially the shots have gone into the arms. Like I said, mine was in March, and right now things are fine. But is there really a way outside of being in contact with COVID to know how effective your vaccine still is at this point?
No, not at all. And I got mine in December. Okay, so
right,
I'm sweating this more than you guys are. But we don't know. But I know people. I personally know people who have had breakthroughs that got their vaccine months after I did. Okay, and I can honestly tell you, for the month of June, I wasn't wearing a mask anywhere. I don't think anybody was. And but I've started to wear my mask again because of what we're seeing.
Question two is, and I'm not sure if this is accurate or not, but I just want to put it up because this is the third time we've been asked this. Why are people not being notified of which variant they have? Yeah. So are people being notified, hey, this is Delta or not? Or is that not happening that you're aware of? And of course, different testing has different sites. And it does take, it's one thing if you come back as positive, it then has to be tested again to say this is Delta variant or not, correct?
Right. So there's two things people need to understand. So we don't test every sample for a variant. That's actually done at UTMB. It's not even done in their clinical lab. It's done in the Galveston National Lab, which is a research lab. And so what they do is they take a small portion of samples every week and analyze them. So, we do about 20, 30 samples a week. We recently increased that number up to about 60 samples a week. And they tell us, how many were each variant. I can honestly tell you, though, right now, if you're positive, it's almost certainly Delta. I think we've had maybe one or two that were not Delta in the past couple of weeks.
And it should, so again, it's a sampling. So even in the lab, that sample that we don't know, it's patient Joe Blow.
No, we do tie it back to a particular sample number, so we could track it back. But the lab doesn't know, and we keep track of them just as a way of knowing who they are. And so we can't tell everybody, you got this or you got that or the other thing. So it's just a way of trying. What we're looking for is percentages. We're not trying to figure out, does this person have Delta and does this person not have Delta?
Right. And that, because it's a whole different process from the general testing. The testing, the general testing we do for COVID, just so people understand, is just that. Says if you're positive for COVID or not. The variant test is a separate test. It's a more detailed test that has to happen afterwards from a positive sample. So that's the challenge. So because we've had the question a lot. And so anyway, and Julianne has a question here too. Does the type of variant you have determine your antibodies? In there, I think that's going along the lines. The antibodies are antibodies, no matter what. The variant is more of a how aggressive it is as far as infection. Correct?
Yeah, that's true. But let's just say, for the sake of argument, what's going to happen to that type of antibodies that you make? You're going to make antibodies against the vaccine if you were vaccinated, which quote unquote partially covers the Delta variant. Then if you get infected with the Delta variant, you're going to make antibodies that are specific against that infection as well. So in some ways, the people that are probably the best off are the people that have had 2 vaccines, had a mild infection with Delta, and because they've had their immune system stimulated multiple times, and we really don't expect them to have any further problems unless something new comes along.
Question along the lines too of, if one of the things is, and we probably see this now more than ever, is that every little bit of research, no matter what corner of the earth it comes from, right now on COVID-19, essentially gets blasted out to the world many times before peer review. Right. Which is not how it normally works. And so we're getting a lot more. I'd be curious about this. I've asked this once before, but how is the medical profession going to deal with the fact that information that normally, because just so if you want the right information to be out, and not taking out, information that could be negative, but just the correct information, accurate information, how do you kind of keep the genie in the bottle so that it's just like, oh, hey, we have this great paper, we want to release it, like the Johnson & Johnson, and then everyone's reacting to that, then finding out after it's been released, well, it wasn't widely studied, it wasn't peer reviewed, it made it to the public domain long before it would have under procedures before internet and everyone was paying much attention. As somebody who's worked in this field a long time, do you even have a suggestion of how that best could be handled? Because the public communication of this, as you have talked about many times, has been confusing for many people.
It's hard. I've been dealing with all my career because we went through the same thing early on in the HIV epidemic. When people were dying and we had nothing to give them, we were grasping at anything that came out. And so initially, this push toward getting information out as quickly as possible, I think, was a very, very good thing because nobody knew anything. But you also have to be a little bit skeptical, and then continue to interpret things as more and more data comes out, and interpret it in light of what we know. So, don't just accept one paper from one person, and compare that to what you already know based on what the science is. And then just try and validate it from more than one source. That's what science is all about. Somebody does something and it gets, even if it gets peer reviewed and published in a good journal, someone then comes along and tries to repeat it, and they say, yeah, see, we got the same result. And after you have that happen 4 or 5 times, oh, this is really what's going on, as opposed to someone gets one result and someone gets another result. When that happens, it's time to step back and say, I don't think we know what's going on in this particular case. Also, keep in mind that just because there's conflict doesn't mean you need to take sides. And I think that's where people most likely get off. I heard one, well, I believe this guy, I believe that guy. Well, my suggestion is don't believe either of them. Just be cautious about it, reserve your judgment. Time will tell. And it can be very, very difficult to, how should I put this? It can be very, very difficult to know what the right thing is and what are actionable things, and that's really what we're looking for. We're looking for actionable things. And so that means we have to take the time to consider and do things carefully before we pull the trigger.
You have said from the get-go that one of the unfortunate things that have happened from this has been the politicization of COVID-19 and public health in general. Can you talk about, because you're commended a lot. I will point out folks who have taken stances on either side of certain issues, from masking to vaccinations to all of this. You're commended by folks that stand on one side. County Judge Mark Henry, for example, he really doesn't think mask mandates work or anything like that. Now, he says if you want to do it yourself, he's fine with that. Private business wants to do it, fine with that. I want to be fair to him here, but he's not been a big touter of that or government regulation. That's more of a philosophical difference. Then the other side is others who out there have said, man, it's great out there. You're telling everyone to get vaccinated. You're telling everyone to mask and everything else. And so but you've said the politicization of this has gone back and forth, national level, state level, and in some cases the local level. You've said that that's been one kind of the downside of things. When we were talking about some of the treatments early on. Can you just talk about in the public health? Does that make your job more difficult, or does it you just ignore it and move on? Because quite frankly, you're even within UTMB, you got to worry about some medical decision being made, and then the next thing you know, the governor says something, or the chancellor says something, or goes along that. The politics comes into play one way or another.
Sure, the politics come into play. I think we've been very fortunate here in Galveston County in that, and Judge Henry in particular, as well as all the county commissioners, really have not. Nobody's ever told me what to do. No one's ever told me what to say. We talk about things. We talk about things privately. We allow each other room to disagree. But everybody, I think, from the very beginning, has wanted to do the right thing. And I think that is what has made us different. And to some of my colleagues who've gotten themselves in fights with their political leadership, I think some of that is, sometimes somebody says something you don't necessarily agree with, and you want to go pick a fight about it, and that's not right. You really need to find those areas of commonality and work through and get on to the right thing. And I know people have different feelings about masks, and I get it. And I also get why people are very skeptical about masks. As public health officials, initially, we did a very bad job about explaining how masks are helpful and why they're important and what are the situations when you should be able to use them. So I don't fault anybody for saying, hey, well, so-and-so said this, or you said that, or you said this. I'd hate to have you go back and pull all the tapes where I've giving people bad advice and bring them out now.
We've talked about that on this show. In fact, let's be fair here. I mean, you and I have talked about early on certain messaging and the like. Let's go in April, or March of last year. Actually, it was like, okay, go ahead, go to the beach, be outside, and the like. Later, based on the information that was coming down the pike, that changed from you. Now, was it bad advice at the time? Not based on the information you've said, but in hindsight, you may have changed up that messaging. But it did change. Masks were the same thing. It was, and a tough thing to say. And I think too, Dr. Ben Raymer, the interim president at UTMB Health, and I spoke about this one time, is that sometimes you have clinicians who talking, and they talk like they're talking to other clinicians. And then you have those who know how to talk to the public, and those get mixed, and acronyms get thrown and folks get confused about that. But I mean, it's not to say you were wrong on anything, but you have admitted it's like, well, we thought this at that time, but we found out later we were wrong. Is that maybe one of the more important things? That we were wrong.
Absolutely.
Maybe not necessarily wrong, but based on the information we had at the time, we thought we were right, but really we did not know this at the time.
Yeah, I think so. I think there's a lack of humility at times, and you see this a lot in academic circles. Someone will come and very confidently say, "This is absolutely what we need to do," and then when something else comes up, they go, "Well, we know," and it's almost condescending as opposed to approaching it with a little humility and say, "Well, gee, that wasn't a good idea," And I don't think we hear enough of that wasn't a good idea. In this business, I think everyone's trying to be, the person with all the answers. And let's face it, this virus has humbled us so many times. We really need to be humble about how we give advice to people.
And I don't want to get into the politics of too much on here, but I do want to play back an interesting exchange that happened between Anthony Fauci, who's now the top medical advisor to the president, and Tennessee Senator Rand Paul. Let's watch this. I want to get your reaction afterwards.
Gain of function research in the Wuhan Institute of Virology, and yet gain of function research was done entirely in the Wuhan is gain of function. They took animal viruses that only occur in animals and they increased their transmissibility to humans. How you can say that is not gain of function?
It is not.
It's a dance, and you're dancing around this because you're trying to obscure responsibility.
All right, so we'll pause that there. I know some people were having a hard time hearing. You had to turn it up a little bit more. I know it's been going around, and that turned into just a shouting match from there, and not on this specific issue, but you just talked about that both sides on certain issues seem to be just infuriated on that. Can you just answer what we were watching there of what you saw there, of this kind of in the public realm kind of battle that goes on there, and maybe how would you have handled it differently if you're sitting?
I don't know. I mean, Senator Paul was being pretty aggressive there, right? And Tony Fauci's a kid from Brooklyn, and so he's scrappy. So it doesn't surprise me that it turned into that, but I think it brings up a lot of other issues, which is really the relationships between public health and elected officials, right? And at the end of the day, as public health officials, we serve the people through our elected officials, and so we have to be responsive to them. I think that in some ways, I can understand why Dr. Fauci was upset. I mean, I think at one point he accused him of killing 4 million people, and that kind of is over the top. But the real issue, I think, is where did this virus come from? And that's what they're trying to get at. And many of the explanations of what was funded and why it was funded really are highly technical. And so I think that's what Senator Paul's trying to get at when he says, you're doing a dance around, the issues here. But at the end of the day, to my mind, this really falls at the feet of the Chinese. And we know that the Chinese are only being, they're not being transparent about what happened in the lab. And I have colleagues of mine who fall on both sides of this issue, people I respect very much, who are very experts, virologists with international reputations, who fall on different sides of this explanation. And at the end of the day, I can assure you that the NIH is not going to fund anything like this again, whether it does fall within that. But I think that we need to have that civil discourse. And that is something that's really very, very important to do. And I don't know how I would have responded if someone were coming at me that aggressively. I can tell you when that happens, it kind of takes you back, and you like to try and keep control of your emotions and say the right thing. But for the most part, having soft answers, I think, does better than yelling back.
And that's one of the reasons, by the way, I should point out, we do this show and talk about these things. So hopefully we're just putting information out and not getting it. And by the way, and I will say this, as I have said a dozen times before, when Dr. Keiser doesn't know, he says it. Says, I don't know. And that's a really good one. He says we need to look into that along the way. There's not been a lot of absolutes that goes along the way. I mentioned it when we were talking about Delta variant before. Lambda variant. Liz Wasco is asking about that. There has been at least one case at Houston Methodist up in Houston where they have say a patient had the Lambda variant. Talk about, again, we should point out the Delta variant is what we were calling the Indian variant before.
Right, that's right.
And then the WHO made a recommendation everyone's following now that we're going to go to Greek alphabets because giving something a location that doesn't mean much more than to say it's a kind of a negative connotation to that country or to that community or something like that. For a while, we were calling things like the Galveston variant and stuff like there too. So, but let's talk about the Lambda variant. What is it, and what in how is it compared to the Delta variant?
Yeah, so it actually came from South America, and it's widely circulated in Peru. And it's not surprising, given all the connections between South America and Houston, that we're starting to see cases of this here in Houston. It seems to be more infectious than the what we call the wild type virus, the original virus that came through. It does not seem to cause more severe disease, although again, those are all questionable. The reason why I say these are questionable is anytime things happen in less developed countries, they tend to have higher mortalities. and it's not clear whether that's the virus or whether that's just the lack of infrastructure in those countries. But so far, we haven't seen a lot of it. We know it's here. Whether it will overtake Delta or not, I think is anybody's guess. My bet would be that Delta has a real advantage and will probably continue to be the dominant variant.
And are there any other variants that are out there right now that we may look to come to the U.S. shores or here in Texas? Delta was one of those that we were starting to see it crop up, but it was minuscule. Then all of a sudden just took over out there. Is there any others that you're kind of watching,
we're watching Delta Plus. So, Delta, there's Delta and there's Delta Plus. So it's basically the Delta variant with one additional mutation, which makes it more easy to infect cells. And so people think that's going to translate into higher rates of infectivity. But as of yet, we have not seen a lot of that. That has been reported in Houston as well.
So again, it's always kind of keeping an eye on things all the way through. Getting back to school here pretty soon. I talked about this. We had a question from one of our viewers. I asked about masking in school. You answered that probably your recommendation would be to go with that. We did have a question from a viewer about all athletes to practice and compete in masks. You took a lot of heat right before the start of football season last year, where you were suggesting actually we needed to hold off on sports. Sorry to put you on the hot seat again. But again, knowing what you know on July 22nd, which could change later today or tomorrow, what would your recommendation be on competition, right? Athletics competition.
Sports are the biggest vulnerability in schools. That's a fact at this point, because what happens is that you go to all this work of keeping the kids separate and keeping spreading from current, and then you say, okay, everybody, let's all go to football practice. And I'm not picking on football. My son was an all-state football lineman. Okay, got a football scholarship for a year. We love Texas football. All right, but I can tell you, if I told him that, hey, you don't have to do 2 a days, he'd be happy. So it is the most vulnerable thing. And yes, we would recommend that people be masking. Basically, even those questions that doesn't even fall under TEA, that falls under UIL. So there are all these different jurisdictions. They all have different rules, and then they have different ways of interpreting the rules. And I think that really is part of the problem, that we're not able to get consistency across the board because of all these different people weighing in.
Do you see us as a community, and a lot of this depends again on the governor, depends on federal guidance and the like, but do you see us going back to some of the shutdowns and restrictions that we saw, or you think that's a thing of the past regardless of what happens next?
I think, and I am hopeful, that is a thing of the past. And let's keep in mind, why did we shut things down? We shut things down to keep hospitals from collapsing. And we certainly saw hospitals collapse in Europe. We saw them collapse in India. We saw them come pretty close to collapse in New York City and in New Orleans. And I think that over the past year, we have learned a lot. And what we have learned is how to not just better prevent it, but how to better take care of people. And so even though we're seeing more people in the hospital right now, our death rate has not increased. In fact, we get better and better every time we go through one of these surges in treating people. So I don't think we will get to that part. And at some point, this is going to burn itself out. It's just that we don't have enough people immunized. There are not enough people out there with the natural infection or natural immunity from infection, so that it won't spread widely. And until we reach that point, we're going to keep going through these surges. But as long as we can keep it to the point where if you go to the hospital, there will be people there to take care of you, and we are able to take care of all of people's other medical problems, I don't see going back to having mass shutdowns.
And along those lines, that you were talking about of not having to go back to those mass fax downs and shutdowns and stuff. One of the things that happened that during this time was we saw the colds and flu go at zero. No, I just saw a study on this, a report on this the other day. The summer colds and the flu are starting to come back now because people are getting out and about again and not being masked up. One of the things you had said, one of the benefits of having people wearing masks and everything else before was it was cutting down on other infections that we normally did. The summer cold and the summer flu, which I always get a summer flu normally. That's what I've been more worried about than anything along the way. What are your recommendations for folks still on how to handle that at this time?
Well, I think the most important thing right now is if you get sick, don't assume it's a summer cold. Go get COVID tested. That actually happened to me like 2 weeks ago. I was feeling really sick, and I'm thinking, I don't think this is COVID. But I got tested anyway, and I made sure. At the same time, other people in my office had similar types of symptoms, got tested, and were positive. So there are clearly other things in COVID that are circulating. But if you have COVID, it's important to know. It's important to know for a couple of reasons. One is that even if you're not feeling that sick, one is that that you don't give it to anybody else. You can take precautions that you don't give it to, to elderly people in your households or family or people that are at risk. That's one. But two, we have treatments that we can give you very early on that will prevent you from getting sick. We have monoclonal antibodies that we give infusions to people, and those things work. We had somebody just yesterday who got one. He said, within 30 minutes, I felt normal, where I felt really bad for days ahead of time. So that's why we think it's very, very important. The second thing is that if you are at all at risk for having a bad outcome with COVID, again, wearing a mask will not only help protect you from getting COVID, but might protect you from getting some of these other respiratory infections, which people sometimes die from. Okay, so it's not just I'm wearing this just to keep me from getting COVID. I'm also, if I get a bad flu and there's something bad going to happen to me, wear a mask. Go ahead. The people that we're really the most concerned about are those people who are unvaccinated and those people who haven't had COVID. You're the guys that if you get COVID, that you're most likely to have a really bad outcome with. And so we just want those folks to get vaccinated. We got plenty of vaccine.
And that was the other thing is that we had a question from one of our viewers here. Regina Haley asked, has our vaccination rate increased since the cases started increasing? Have you seen more people? Because it is readily available. I mean, now you can just walk up in many cases. And get a vaccine somewhere. Have we seen an increase in folks asking, well, let me go ahead and get a vaccine?
Yeah, we've seen some, but it's not been proportional to the increase in cases, So it's certainly gotten some people concerned, and people are more likely to get vaccinated. And I'm also finding people that have been holding out are kind of going, okay, maybe it's time for me to get it. And so, now as we're seeing these numbers go up, we would say now is the time. Don't wait anymore. There's no reason not to. A lot of people they're digging their heels in. They're figuring, well, the government's trying to make me do it. I'm not trying to make anybody do it. This is good for you. And people say, well, it's not been tested. It's been tested. We've given it to hundreds of millions of people. And well, it's not fully authorized. That's true, but trust me, we know more about this vaccine than vaccines that are fully authorized. So there's really no rational reason not to do it.
One of the interesting things on that, I saw a remark by somebody, someone had said that they weren't going to get the vaccine even after getting COVID because it had not been authorized while being treated in the hospital with treatments that had not been fully they were under emergency authorization.
That's true.
We point out a lot of these treatments we're talking about right now too are under emergency authorization too. And that's just one of the things going on. I know you'll be able to speak more to this at UTMB Health, but our area medical centers, Memorial Hermann, Methodist, and UTMB Health all announced recently some revised visitors policies and the like because of this outbreak. And right now, obviously, this is where you're going to have people most vulnerable is in a hospital setting. I know it gets frustrating when folks feel like they have to do more than they need to. What are some of the ones that you're hearing the best policies that are taking place right now?
Well, I think, probably the best thing is, making people wear masks when they come to the hospital and asking people that if you've been sick, not to come in. And then probably the other thing that I think is going to be very effective is having some limits on the number of people that can come at any one time and how long people can stay. And so, it's all about that contact. And I think that's probably going to be one of the more effective measures at this point. And once numbers go down again, we'll back off, So this is really just in response to the increasing numbers.
And it could be ever changing too. We should point out, right? It's
Yes.
It's not something that just that'll stay on the whole time there. And now we're getting ready back to school. We talked about vaccination. How about vaccinations overall, not just COVID-19, but there's the back to school vaccinations that are that happen on. I know the Coastal Health and Wellness provides those for folks that need them and the like. Because I know what folks may forget that, hey, back to school is just around the corner. We're talking next month.
Right.
I say next month, just a few weeks actually.
Right.
Here. What are the vaccinations outside of COVID you recommend and get done right now? And can you do them all at the same time? That's the question that I've been asked a lot. Like, well, if I have the COVID vaccine, do I have to wait on everything else?
Not anymore.
With my kid?
Yeah, not anymore. Initially we said yes, and the part of the reason we said yes was that you had to wait was because we didn't know, and we also didn't want to have scenarios where, let's suppose we gave you 2 vaccines and one of them was COVID, and then you had a reaction. Which one did you have the reaction to? And but as we gained more experience with the COVID vaccine, we realized that wasn't an issue. So now you can get your COVID vaccine and other vaccines on the same day. We're actually going to be having a back to school push. At UTMB clinics, and then also the health department is going to be actually scheduling health fairs, and we're really going to be pushing vaccination overall. Get all the childhood vaccinations, get them up to date. Get the vaccines that kids need to get to go to school. Get flu vaccines for adults. In addition to flu vaccines, get their pneumonia vaccine. Get their tetanus vaccine. We all forget to get our tetanus vaccine until we step on a nail or till we cut something. And you go to the doctor and you go, "When was the last time you had one?" You go, I don't remember, right? I honestly have never seen a case of tetanus in my entire life. And that's because of the vaccine. And so these are very, very important things, and it's important to keep everybody up to date. So as we move forward, we're really going to be pushing a campaign of overall wellness, not just anti-COVID, but really using the COVID milieu and money that the state and the federal government is giving us to encourage people to be healthy overall, not just avoid COVID.
Dr. Philip Keiser, the local health authority for Galveston County, also the interim CEO and director of Galveston County Health District and Coastal Health and Wellness, and find out to find out too if you're getting much sleep these days with everything else you had going on. That we'll talk about the importance of sleep probably in our next show on there. Anything else before we wrap up today, Dr. Keiser?
Get vaccinated, get vaccinated, get vaccinated. I know I sound like a broken record, but I mean it. And actually, we've been chipping away at it. We're not having the great demand, but if you look at where we were a month ago, we're getting closer to 60% of people with one shot in arms, and that's, I think, a real accomplishment. So, now's the time. If you know somebody in your family hasn't gotten vaccinated, talk to them. Don't beat them up, because that doesn't work. Just talk to them and keep talking to them till they get it.
Dr. Keiser, thanks a lot. I appreciate it as always. And again, folks, as we had warned when we started these back up again, they will fluctuate. Dr. Keiser is far busier than he was before. We will try to do them on Mondays at 1. This past week, obviously, I was out of the country and came back, and I'm fine, by the way. But I'm not isolating so much, but I am double checking on things along the way. And did a test yesterday. I should have my results here shortly, just to double check and make sure. But I'm fully vaccinated, so that's the good thing.
There you go.
As well. Point out, took a cruise and followed all the rules that you gave me there, and that'll be something I'll be talking about a little bit later, because the cruise line setup, there were a lot of changes they made that I really enjoyed that made things go faster, actually. That were a better process. So along the way. So we'll talk about more of that with folks from Carnival and some other of my fellow cruisers who were on with us. We're gonna do a little special on that as well coming up next week. So Dr. Keiser, thanks for coming on with us. We appreciate it. And keep us up to date on everything as you have been doing.
Okay, thank you.
All right. And that'll be it for this edition of What You Need to Know with Dr. Philip Keiser.
Hi, I'm Christina Garcia. I'm the Patient Services Manager at Coastal Health and Wellness. I want all Galveston County residents to know that the open enrollment for the healthcare insurance marketplace is now. At Coastal Health and Wellness, we understand the importance of having access to high quality health care. And we understand that the application process can sometimes be stressful, trying to figure out which plan is best for you and your family. So we have certified application counselors that are waiting to walk you through the process. There are 4 categories of plans to choose from, and our counselors will help you through the process. All the plans will cover essential health benefits, pre-existing conditions, as well as preventive care. So what do you need to know, Galveston County residents? The time to act is now. If you need assistance or if you have questions, call us. At Coastal Health and Wellness, we're here to help you.